Hello, and thank you for this opportunity to bring you my story of loss and change. Thank you to those of you for being open to hearing about collaborating for safety. I'm Melissa Sheldrick. I spent most of my career as a teacher and now work as the first ever patient and family advisor at the Institute for Safe Medication Practices Canada. Andrew was a happy boy who loved trains, swimming, and soccer. He was a loving and caring friend who was sensitive and empathetic. At the age of 5.5, he began having night terrors, waking often in the night screaming. We spent many sleepless nights visiting a variety of healthcare providers, doctors, behavioral therapists, psychologists. A sleep study revealed that Andrew had parasomnia, a sleep disorder. The doctors suggested a prescription for tryptophan, an amino acid, to help regulate Andrew's sleep cycles. He needed to take 5 tablets daily before bed, but they were large and chalky, so we had to crush them and mix them in applesauce for him. But it worked. He slept better, his days and evenings were better. A year later, after a repeated sleep study and recommendation to maintain the same dose, I asked if there was a liquid formulation, but there was not. The doctor suggested we get the medication compounded into a liquid at a specialty pharmacy. I had no idea what compounded medication was, but after some research, I found a pharmacy close to home, and they were able to fill the request. For 18 months, we refilled the prescription every 2 weeks, and it was the answer we needed. One Saturday evening in March of 2016, I gave him his dose, tucked him into bed, and kissed him goodnight. He didn't wake up in the morning, and we had no idea why. For 4.5 months, we tried to put one foot in front of the other, but were grief-stricken and traumatized. We then learned that a mistake had been made during the dispensing process of Andrew's medication, and instead of tryptophan in his bottle, there was baclofen, a powerful muscle relaxant mixed in the same concentration as the tryptophan, 3 times the lethal dose for an adult. My grief, trauma, and now anger spurred me into research and asking questions. How do medication errors happen? What will come of this situation? I soon discovered that there was no accountability on the pharmacy and pharmacists to make changes so that this would not happen again. At that time, I made it my life's work to ensure that change would happen so that another family would not have to go through this pain. Through media coverage, with the help of my local government officials and the support of my friends and families, we began to raise awareness of this gap in accountability. I began an online petition to request that medication error reports in community pharmacies be anonymously reported for the collection of aggregate data and analysis. It was imperative for me to know that learning would come from the errors that took my son. After more than 20,000 signatures, I met with the pharmacy regulator in my province of Ontario, and they invited me to be part of the task force that would create a mandatory, continuous quality improvement program for community pharmacies that would include the anonymous reporting of errors and near misses. This was the first time they had invited a member of the public to be part of this type of task force. When incidents occur, it's critical to engage patients and families because we see through a unique lens that cannot be replicated and leaves a gap when it's missing. Being part of this system improvement meant that my lived experience was valued and would help inform the change, which I believe made it more effective and sustainable. We now have the AIMS program, Assurance and Improvement in Medication Safety, a standardized medication safety program for all community pharmacies in Ontario. Those 4 pillars represent the highest quality of improvement and best chance of error prevention. In tribute to Andrew's life and legacy, the A and the S in the logo are deliberately placed and in dark blue. These are his initials. When I began the work of advocating for CQI programs, the only one in existence in Canada was in the small province of Nova Scotia. I began to speak to regulators in every province as healthcare is a provincial jurisdiction in Canada. With the advocacy I have done, the work that ISMP Canada has been doing, and our combined efforts of sharing Andrew's story together, we now have 6 provinces with a CQI program in place and 2 more coming next year. This is the goal that we are working towards. The authors of this article stated, in 2 short years, she accomplished what the evidence from Nova Scotia could not. She persuaded all of the provincial pharmacy regulatory bodies to implement or explore implementing new standards of practice. People with lived experience have the ability to influence system-wide improvements, and these early adopters were receptive to my message. I am an active member of Patients for Patient Safety Canada, an arm of the WHO's Patients for Patient Safety Global Network. We are volunteers who have experienced preventable harm from healthcare and who are committed to collaborate with healthcare providers for improvement. We are committed to investing time, emotions, and energy to prevent harm. Communication and collaboration are truly the only way forward. I ask that all of you commit to this collaboration. Let us champion initiatives that promote transparent communication between healthcare providers and patients. When patients feel heard and understood, the likelihood of errors decreases significantly. Shared decision-making at the point of care can lead to safer and more effective care. Together, let's work towards a healthcare landscape where patient engagement and education are at the heart of safety efforts. Small steps forward are key in starting the ball rolling. I had no idea what would transpire when I began that online petition. Healthcare leaders, providers, and policymakers, create open and interactive communication paths for patients and families to know that you support a safety culture that includes their key perspective. Changes are more authentic when the patient lens is part of the improvement design. You can provide such things as materials co-created with patients, online resources in plain language, and verbal explanation to help patients understand their diagnoses, medications, procedures, etc., as this empowers patients and caregivers to take an active role in their own safety and care management. Our questions will help guide that dialogue. Let's use our past successes as a springboard for future endeavors. By persistently pushing for standardized protocols, embracing processes to prevent errors, and fostering a culture where learning from mistakes is encouraged, we can continue making strides towards safer healthcare. The road ahead might be challenging, but education and experience teach us that as patient safety activists and committed healthcare leaders, we have the power to transform the landscape of healthcare for the better. This synergy is like a symphony where patients and healthcare professionals are the musicians, each with their unique instruments and expertise. Just as the conductor leads the orchestra to harmonize various sounds into a beautiful piece of music, collaboration between patients and providers orchestrates the blend of medical knowledge, personal experiences, and shared goals. Each note played by the musicians contributes to the overall melody of improved safety and better healthcare outcomes. A symphony requires communication, coordination, and synchronization, just as successful collaboration in healthcare relies on an open dialogue, shared decision-making, and a coordinated effort to create a harmonious and safe healthcare journey. Each day, countless lives are touched by the impact of patient safety initiatives, and it's through our collective efforts that we can make a true difference. Let's continue to amplify our voices, share knowledge, and drive change to ensure that patient safety remains at the forefront of healthcare priorities. Remember, our advocacy isn't just about addressing current issues, it's about fostering a culture of safety and improvement for generations to come. By staying informed, engaging in open dialogue, and urging policymakers and healthcare leaders to implement evidence-based practices, we can create a lasting legacy of improved patient outcomes. For Andrew, for all of us, thank you.